David from Nottingham is one of the first patients in the city to receive a personal health budget as a direct payment for healthcare.
Originally I was voluntary and now I work alongside the council part-time as a service user input around the personalisation agenda. There's a bit of a downside to it because even though I get a direct payment which meant I could do this job, I also have one or two health problems where I have a district nurse who comes in the morning which then used to delay me going out to work.
I'm Jane, I'm David's PA. I've been his PA now for 5 years. Sometimes the nurses were really late or they just didn't turn up or let him know so, and if he'd had a shower, you were stuck. If he's got an appointment at the hospital, it was really frustrating for him.
I've got paraplegia from T5, which is from the chest down. I've had that for 9 years now, and I'm in receipt of direct payments for my social care. When I first heard of the health personal budgets, I thought that was a good idea, and I became part of the pilot project that's going on in Nottingham. So now I've gone down the road of a personal health budget, which gives me funds to provide for my personal health care in the morning.
What would you be doing today, Jane?
Your health needs are assessed, and then you have outcomes. And then from the outcomes you do what's called a support plan. And then from the support plan that will show how you're going to spend your health budget to meet the outcomes using the support plan. In my case, I suppose you could say it was fairly easily because I have a district nurse which was primarily just for dressings every morning. It was quite easy to work out what my health needs were, and it was quite easy to see that I could train my PAs, take over that role and administer the dressings etc. in the mornings.
No.
David's dressings need changing daily. With his personal health budget, David was able to arrange training for his PAs to do this, rather than waiting for the district nurses each morning. As David's PAs can change the dressings any time, this frees him up to go to work when he needs to. The district nurse now comes for a weekly check. David found that by making a straightforward change, a big difference was made to his life.
Well, now he doesn't have to wait. He can have his shower when he wants. If he wants a shower in the night, then he just showers and we change his dressings straight after having a shower, which means there's less chance of him having infections because he hasn't got to wait for anybody, so because we're there to do it.
The district nurse becomes what you class, I suppose, as your care manager. So that as Jill and Jane administer all the care you need, periodically they just come in and check everything's fine.
A tissue viability nurse came out and we had to show him what we could do with his feet and how we changed his dressings, and he okayed us to do it.
Since receiving his personal health budget, David has also become more involved in the Nottingham pilot programme.
It's quite good being on the, I suppose you could say the board of the project really, because you can see how different people use their budgets differently. It just shows you how wide and varied that the options are really. In using a personal health budget, that now just gives me that extra freedom to do what I want to do.